Right, my name's Dr. Tim Alexander. I'm the Chief Plastic Surgeon at the Florida Center for Cosmetic Surgery in Fort Lauderdale. Today we're going to talk about transgender surgery. Now this transgender is going both ways, female to male and male to female. We'll talk about both of them because we do both of them here. We don't do any genital surgery. We just do top, facial and body surgery. The most common one probably we do is male to female, which can start off as simple as doing just straight breast implants, and then it can go on to doing facial feminization, which can be rhinoplasty, eyelid, facial fat manipulation, Adam's apple shaving, and then on the body we can do body contouring and shaping and BBLs, called Brazilian butt lift, which means taking the fat out of the rest of the body and injecting the concentrated fat into the buttocks. In the female to male, which is a more complicated operation, but I do quite a lot of those, it's to make the breast, really doing a subcutaneous mastectomy and making the sometimes quite large female breasts look like male chests. And that's done by, as I say, a subcutaneous mastectomy, and the nipple is transposed either as a graft or as a flap. A pedicle underneath the skin, and I do both of those kinds too, and that involves sometimes liposuction as well. These operations are very satisfying for me and the patients because it's very important to them to have their mind and their body self-ID, sexual ID, corresponding with their bodies. Like if they feel like they're a male and they've got a beard on their face, for example, and they've got breasts, well, obviously they don't feel very comfortable with them. So it's very satisfying to make them get away from wearing binders and suppressors and things like that, so that they can wear t-shirts and look like having a real male chest. And vice versa, the feminization ones, the girls, quote, like to feel feminine, and they feel much more happy with themselves. And we help them if they want to do change of sexual ID. We give them fill in the right paperwork for them. So, for example, on their driver's licenses, and they can change their identity from male to female. We help them out with that as well. Right. Well, like facial feminization can be, it depends on what the individual looks like. They can look quite feminine right from the start, but there's a lot of things you can do to enhance it. You can do cheek implants, and a rhinoplasty, make the nose a bit smaller, raise the eyebrows, or take some skin out around the eyes to make them look more look more alert and feminine. You can take some fat out of the cheeks, called a buccal fat pad removal. You can do liposculpture of the neck, a small chin implant, and even a facelift will often make somebody's appearance more feminine. And the other thing, as I mentioned, is a tracheal shave, which a lot of people quite like, that to make them look feminine. Okay, well, like the recovery from these procedures differs from each procedure. Most procedures you're in pretty good shape within 2 weeks. Some even as soon as a week. But for example, fat transfer to the buttocks, you can't sit down for a week, but within a month you're looking pretty good, and you can go back to the gym and start exercising there. Facial feminization, you're looking really pretty good in 2 weeks and pretty well much in great shape after a month. The breast surgeries, about a month too before you can go back to full activities. Okay, now if you want more information on this topic and others, feel free to contact us on the phone, emails. We do virtual consultations, and sometimes we'll have virtual voice consultations as well as visual ones. And we can work out with you and give you a lot of information before you even decide what you want to do or how you want to progress with the surgery. Okay, if you like this video, don't forget to like and subscribe. Thank you.